Hello, Assalamualaikum. My name is Zul, and today I will be explaining about epilepsy and seizure. So let's move on to the definition first. Okay, let's start with the definitions of epilepsy. So epilepsy and seizure is actually the same thing, but there's a little bit different. Epilepsy is a big topic, and seizure is the under it. So epilepsy is a chronic neurologic conditions of recurrent unprovoked seizure. There's two keywords here: chronic neurologic conditions, where it happens in the brain, actually neurology. So neurologic condition, which is chronic, happens in a lot. There's a durations of time. So, and then of recurrent unprovoked seizure. Recurrent happen again and again, unprovoked. There's no any triggering factors to the seizures. So there's no definite cause to the seizure itself. So unprovoked seizure. So you have to remember, epilepsy is a chronic neurologic condition which of recurrent unprovoked seizures. So then we call it epilepsy. What is seizure? So seizure is temporary involuntary change of consciousness. There will be a loss of consciousness and behavior change in behavior, motor activity, sensation, automatic and automatic functioning. So that is seizure. So what is provoked seizure? Provoked seizure is something that triggered the seizures, such as fever, acute illness, and also it could be CNS, central nervous system infections. So this thing will lead to seizure. So this is the provoked seizure. So epilepsy is unprovoked seizure. So there's no definite cause, no fever, no acute illness, no CNS infection, and then the individuals have seizure, and it is recurrent, so we call it epilepsy. So okay. Okay, next I'll talk about the types. So there's actually two types: generalized seizure and also partial seizure. So generalized seizure is divided into another five, and partial seizure divided into two. So what are the difference between this generalized seizure with partial seizure? So generalized seizure is actually involve a lot of muscles. So a lot of muscle cells. So actually generalize all the body, all the muscles. So it affected that part of the brain also, and affected part of the muscles. So whereas the partial seizure is only focused on one muscle or one single cell, one single muscle cells. So you can see maybe just the face twitching, not there's no any movement, tonic clonic movement and all. So it's actually like face twitching, lip smacking. That's its partial seizure. It's focal, only focused on a single muscle cell. So generalized seizure is divided into five, which is tonic-clonic, absence seizure, myoclonic, atonic, and atypical absence seizure. Whereas the partial seizure just divided into two, simple and complex. So I will explain in detail on the next slide. Hello, so now I will explain about the tonic-clonic, the absence seizure, the types in detail. So the tonic, before that, I will explain the terms. Tonic is actually increased tone when your range of movement, your joint becomes very stiff. So increased tone, very hard to flex your hand. So we call it tonic because you can see the back, the arching back and neck. So that is what we call tonic. What is meant by clonic? It is actually the rhythmic muscle contraction. So you can see the jerking movement because the muscle is contract. So it's rhythmic, contract, relax. It happens for a few minutes, and then for the myoclonus, which is myoclonic, the myoclonus is a shock-like contraction. So it happens like when you are in shock, like electric shock, and then it becomes normal again. So that is the myoclonus that, and then it becomes normal slowly, gradually. Yeah, that is the term for ours. That is the terms tonic, clonic, and also the myoclonic. So what is the tonic clonic seizure? tonic-clonic seizure, it meant the rhythmic muscle contraction and relaxation happens. So, like I say, uh, your joints, your movement becomes very stiff at first, and then, okay, the patients, the individual will collapse. After collapse, it have the muscle contractions, the jerky movement. So that is what we call tonic-clonic seizure, because the tonic happen and then the clonic movements also happen. So that is the tonic-clonic seizure. And usually, in tonic-clonic seizure, the individuals, the child or the patients may have an aura first. Aura is meaning of aura is actually you have the sensation that the seizure might begin. So let's say before he, the individual is going to seizure, he or she might feel anxiety first, fear, change in behavior a bit. So the individuals have an aura. They have the sensation that, oh, the seizure might happen in a few minutes or a few seconds. So that is an aura. So you have to ask, you have to see this tonic-clonic seizure. Usually they have an aura first, and then happen the seizure, or we call the ictal phase, and then happen after the ictal phase, the seizure phase, it have the post-ictal phase. Later on, I will show you the graph, the aura, the ictal phase, the seizure phase, and also the uh, post-ictal phase. What happens after recovery? Yes, and also this tonic-clonic seizure, it can involve at any age, but usually child is common, but it can happen in any age and may last up to 5 minutes. So this seizure may last up to 5 minutes. If it more than 5 minutes, you have to think other as which is the medical emergency. Later on, I will explain about the status epilepticus. If it is more than 5 minutes to up to 30 minutes, but this tonic-clonic seizure, just remember up to 5 minutes. Yes. Okay. And then followed by post-ictal period, 1 to 2 hours. Post-ictal period after the seizure phase, the ictal phase, we call it post-ictal phase. Post-ictal phase is actually uh, what are the uh, what are the individuals feeling, whether not feelings like I say, what are the individual's reactions, such as drowsy, sleepiness, or vomiting. So you have to take note all these things, because later on in treatment, I will talk. This thing is very important. You have to take note. You have to see, and you have to observe what happened. Okay. Next one, I will talk about the absence seizure. So absence seizure is actually uh, just a blank stare. So usually we mistake it with daydreaming, because sometimes this blank stare can be mistaken with daydreaming. So it's actually the momentary loss of awareness and also absence of motor activity, except eye blinking or rolling of the eyes. So that's actually the motor movement. There's no movement. It's actually static, but then sorry, but then the eye blinking still happen. But other movement is static. So that is absence season, and there will be no aura. There will be no post-ictal period, and also usually last less than 30 seconds. So not like tonic-clonic seizure up to 5 minutes. It can happen up to 5 minutes. Okay, next one. So next we go on to myoclonic seizure and akinetic seizure. So actually myoclonic seizure and akinetic seizure is the mild one, not like tonic-clonic or absence seizures. So actually not like tonic-clonic seizures. So myoclonic and akinetic is the mild one. So actually myoclonic seizure is a single or small group of muscles. Like I said, it's a like shock like with contractions. So when happens a bit and then gradually will improve. That is myoclonic seizure, not like tonic-clonic seizure where the tonic happens, the clonic also happens and it up to lasts up to 5 minutes. So akinetic seizure is actually loss of muscle tone. So when I say loss of muscle tone, so when uh, previously, I've said about the tonic. Tonic is your movement becomes very stiff, but in this akinetic seizure, you have loss of muscle tones. You're very flaccid, like your hands, no tone, like no. That's why it called loss of muscle tone. Yeah. Okay. Next one, I'll talk about the medical emergency, which as I said earlier, status epilepticus. Status epilepticus, whereas more than 5 minutes up to 30 minutes. So you have to see the duration. So what is important in seizure is actually how it manifests the seizure, what happens, whether it's tonic-clonic, whether it is myoclonic, the shock-like wave contraction, or whether it is absent seizure. So you have to see how the seizure manifests and the duration. So in status epilepticus, more than 30 minutes, and then require emergency medical attentions because it happens for a longer duration. So your body needs a good hydration, needs a prop, needs fluid resuscitations and all. So you have to call an ambulance for this one, status epilepticus. So that's why it is important the timing and also how it manifests the seizure, how it happens, and important also what happened after the seizure stops. So whether the post-ictal period, it is important you have to know whether the patient, the individual is drowsy, whether he or she vomit after the seizure. So this one you have to take note. All right, next one. Okay, now I'll talk about the partial seizure, which is simple and complex. So simple partial seizure is usually involve motor cortex and result in clonic activity of the face or extremity. So it's just a clonic activity. Clonic means, like I said previously, it is the rhythmic muscle contraction, the clonic, the jerking movement. The small muscle contracts and relax, contracts and relax. So you can see the jerking movement. So what is the complex partial seizure is actually originates from temporal lobe. So difference is simples in the motor cortex, but then in the complex it happens in the temporal lobe. So the temporal lobes is the automatic reactions such as lip smacking, chewing, buttoning and unbuttoning clothing. So individual may appear confused, disorganized, and sensory experience such as hearing sounds of various types in environment also. So that is the difference between simple and complex. Yes. And difference is the simple partial seizure uncom- uncommon that the patient have loss of consciousness. So they still actually uh, alert on their surroundings. So there's no loss of consciousness in simple partial seizure. Okay, so this is the graph that I talked earlier. So aura first, so 1 to 10 minutes actually before the seizure happens, and then ictal phase. The ictal phase is actually where you can see the seizure phase. It's the highest one, the peak one. So and it is to happen 2 to 3 minutes. So if it happens more than 30 minutes, so it has status epilepticus. It's a longer durations of the ictal phase. And then post-ictal phase where the seizure has come down, has stopped. Then what you have to see whether the patients, whether the individual's drowsy, what are the reactions, sleepiness, or uh, vomiting, or have fever, something like that. So what are the body reactions towards the seizure? So this is the graph. Last but not least, I will explain about the treatment. So basically, this treatment just for the first line treatment. So what happens? when you see an individuals that have seizure, and what are you going to do? You are the first line treatment. You are the first person encounter the situations. So I'll talk briefly about the first line one, which actually you have to remain calm, because and then remember what I explained earlier, the importance one, you have to time the durations, because we want to know whether it going to status epilepticus or not. So time the seizure, protect the child during seizures. So it means if it happens uh, on a bed, so make sure that the individuals do not fall, and make sure there's no sharp objects surrounding the individuals. So make sure he or she is safe during that time. The surroundings is safe. It's very safe. And then allow seizures to end without any interference. Just keep watching, keep observe what are the type of seizure that manifest, whether it's tonic clonic. But then do not interfere. Uh, do not interfere with the seizure. Do not try to stop the jerky movement, the uh, the jerky. Do not attempt to stop that thing. So allow the seizures to stop, uh, to end itself. So and then after that, when the seizures stop, so you have to check the breathing. You have to check whether the individual's breathing, and then time the post-ictal period. So time the post-ictal period. So when it stops, time again. So previously you time during the seizure phase, the ictal phase. Now you time the post-ictal period, and then watch for mouth or head or any body injury for the patients. And then, okay, that is the first line treatment. But you have to call the ambulance, whether this is emergency or not. Not to call ambulance if it is not status epilepticus. After the seizure stop, after you time the procedure, and then bring the individuals to the nearby hospital or clinics to check. And then, but if it is emergency more than 5 minutes, call ambulance right away. So when to seek help if child like very urgent things, you have to call ambulance. When the individual is not breathing, or in status epilepticus more than 30 minutes, 5 to 30 minutes. And then if it happens during in swimming pool, so ask for help. Do not remain calm, but ask for help. Do not do on your own. Yes. All right. This is actually the treatment, the anticonvulsive treatment, but this one in a hospital setting. So the commonly used one is sodium valproate, carbamazepine, phenobarbital, phenytoin, benzodiazepine group, clozapam, diazepam. That is to stop the seizure, but then this is in hospital setting. So like for the first line treatment, if outside